Good morning, good afternoon, good evening everyone. Whatever time you are watching this video, my name is Athea Nicole, Alcera, and for today I am gonna discuss to you the assigned topic for me, which is the lung abscess. So I know you guys have already encountered this word lung abscess, especially since we already had our duty in the pedia ward, especially with patients with pneumonia. One of the complications is lung abscess, so hindi na to bago sa inyo. So ano nga ba ang lung abscess? So, lung abscess is a localized collection of pus caused by microbial infection. It is generally caused by aspiration of anaerobic bacteria, often resulting from aspiration of oral secretions or foreign objects into the lungs. So, these bacteria that causes lung abscess are mainly bacteroid species, specifically gram-negative Bacteroides fragilis, Fusobacterium capsulatum and necrophorum, and also gram-positive anaerobic Peptostreptococcus and microaerophilic streptococci. So, it is also a necrosis of the pulmonary tissue. Pag sinasabi nating necrosis, it is the death of tissue cells or cell tissues and forms cavities that contains necrotic debris or fluid that is caused by microbial infection. So, pag sinasabi nating pus, yung direct translation ng pus natin is nana. So, basically, lung abscess is nana na andoon sa ating lungs. So, I have here some examples of the lung abscess pictures. So, first one here, makikita natin na yung lungs is meron siyang space, may hole, kung saan naroon yung abscess or pus or nana before. And the next one naman here is, this is a chest x-ray of a patient who has lung abscess. Next, lung abscess can be classified based on the duration. We have acute and chronic abscesses. So with the acute abscesses, they are less than 4 to 6 weeks old. So a month and a half, no? And chronic naman are of longer duration, so more than 6 weeks old. Also, we have primary abscesses and secondary abscesses. Sa primary abscesses, they are infectious in origin and develops in a region of pneumonia or another lung disease. So, it can be due to tumors, also lung disease, and immune deficiency. Secondary abscesses naman are caused by pre-existing condition. A secondary lung abscess occurs when an infection from another region of the body spread to the lung. So, causes of secondary lung abscesses can include aspiration of infective material from the mouth and upper airways. So, one of the preventative measures para ma-prevent natin ang lung abscess is having good oral hygiene. Now, I will discuss to you the pathophysiology of lung abscess.
So, we have here our modifiable and non-modifiable factors. So, sa modifiable factors muna tayo. So, these are risks that can be changed or managed. So, first we have smoking, as cigarette smoking can impair lung function and immune response, increasing the risk of infections. Next one, we have alcohol use, as excessive alcohol consumption can lead to aspiration, especially because it affects our consciousness, no? Thus affecting also our swallowing reflexes. Next, we have our chronic diseases. So conditions like diabetes, COPD, and immunosuppressive diseases can be managed to reduce the risk. Next one, we have our oral hygiene. So poor dental health and oral hygiene can increase the risk of aspiration of bacteria from the mouth. Next, we have aspiration precautions, especially in high-risk individuals. Examples, those with swallowing difficulties. The next one we have is our non-modifiable factors. So these are inherent characteristics that cannot be changed. First, we have our age. Second is gender. So some studies actually suggest that males may be at higher risk for lung abscesses compared to the females, because it can be possibly due to the higher rates of risk behaviors, especially since mas sa kanila ang smoking and alcohol use. Next one is we have genetic predisposition. So first, we have the aspiration of oral anaerobes into the lungs. So this is the infection initiation, no? So aspiration of oral anaerobes is the primary lung abscess. It may also occur secondary to mechanical or functional obstruction of the bronchi by tumor, foreign body or bronchial stenosis, or from necrotizing pneumonias, TB, pulmonary embolism, or chest trauma. So initially, the cavity in the lung may or may not extend directly into the bronchus because the bacterial infections that invades the lungs through the alveoli. And during this phase, the alveolar type 2 cells is activated in order to keep the function of the lungs to keep on going and optimize the conditions for gas exchange and prevent respiratory failure. So these type 2 cells are defenders of the alveoli by secreting surfactant and keeping the alveolar space relatively free from fluid, serving as progenitor cells and to repopulate the epithelium after injury and providing important components of the innate immune system. This formulary surfactant is composed of lipids and 4 lipid-associated proteins that regulate surfactant function, structure, metabolism, and innate host defense. And once na, the second one is magkayaon na kits and loss of effectiveness of the defense mechanisms and aton lungs, then magkakayaon kita inflammatory reaction because the immune system fight back, causing inflammation, and so the leukocytes will go to the site of injury together with monocytes, lymphocytes, and neutrophils in order to fight back the bacteria. So of course, since fight back ang aton immune system, magkakayaon kit fever and chest pain and weight loss. Then the cavity extend to the bronchus, but for other circumstances, the cavity may or may not extend to the bronchus or pleural cavity or both. Then the abscess becomes surrounded or encapsulated by a wall of fibrous tissue. So after a while, the cells forms a capsule or surrounds the abscess in an attempt to contain the bacteria in that area and prevent it from invading or infecting other areas. Since there are necrotic debris inside, the necrotic process begins. So as I've mentioned earlier, necrosis is the death of cell tissues. So nagbibigin na yung necrotic process, and in this abscess, it contains living and dead WBC, damaged tissues, germs, and fluids that build up the abscess as the necrotic process begins because of the dead white blood cells and damaged tissues in the lungs, and even the bacteria is present in the area, and this erodes the area of the cavity and can spread to the pleural cavity or bronchus or to both of them. As the necrotic process begins, we will have these clinical manifestations. So these are just some of the clinical manifestations, which is weakness and dyspnea or shortness of breath. So as the necrotic process begins, pwede mangyari sa ating bronchus, in which formation of purulent sputum will occur, and we will have productive cough. Then, kung sa pleura naman natin, sa pleural space, na nangyari ang necrotic process, tinatawag siya na emphema, in which it is a collection of pus in the pleural cavity. Then, magkakayaon kita sa bronchopleural fistulae. So, this is an abnormal connection between the bronchial tree and the pleura space that can develop, and mas nagko-complicate an treatment for this. Then, we will have respiratory failure. So for our laboratory and diagnostic exam, we have physical exam, so auscultation for breath sounds and percussion. So pag percuss, mayaon dull sound and aton lungs. Then we have chest x-ray and computerized tomography or CT scan. This is for imaging. Next, we have sputum culture for bacterial analysis and bronchoscopy. So your doctor might use a device called bronchoscope, which is a thin tube with a light and a camera on the end para maimod kod dito sa aton sulod sa lungs. So for the medical and surgical management, we first have our medication. So IV antimicrobial therapy, the standard treatment are clindamycin, ampicillin, sulbactam, or carbapenem. And large IV doses are given because the antibiotic must penetrate the necrotic tissue and the fluid in the abscess, because this necrotic tissue is very hard to penetrate. Even our blood cannot penetrate it. So the treatment of antibiotics will last up to 3 weeks or longer, depending on the severity and the organism involved. And once improved, is also demonstrated evidence by chest x-rays that shows the absence of the lung abscess, so the patient is switched to oral antibiotics therapy for an additional 4 to 12 weeks or longer in order to prevent any relapse to occur. Next, we have our drainage. So, adequate drainage of the lung abscess through postural drainage or chest physiotherapy. So, drainage is performed in order to drain the abscess in the lungs and can treat and prevent the infection. Chest physiotherapy is performed to help remove excess mucus from respiratory passages and also to improve breathing. Postural drainage positions is also one of the medical management. And by the way, sa administration ng antibiotics natin, the patient needs to be monitored well because the drug clindamycin has an adverse effect of vomiting, nausea, and joint pain. The ampicillin sulbactam also has an adverse effect of swelling of the eyes, face, mouth, lips, tongue, and throat or lower legs. So we have to watch out for these adverse effects during the IV therapy. So after postural drainage positions, we have surgery. So sa surgery, pulmonary resection or lobectomy is performed. But this is in very rare cases na surgery may be required. The most common procedures are these lobectomy in which tinatanggal yung lobe ng ating lungs. Then we have our high protein and caloric diet. A chronic infection is associated with a catabolic state. Therefore, increased intake of calories and protein facilitates healing. A catabolic state is when the body is breaking down or losing overall mass, both fat and muscle body mass. So, kailangan mataas ang ating protein and caloric diet. So, for our nursing management, we first have administer antibiotics and IV treatments as prescribed and monitor for adverse effects. As I've said earlier, the said drugs, the clindamycin, the ampicillin sulbactam, the carbapenem has different adverse effects, so we need to watch out for all of those. And next, we will provide health education on performing deep breathing and coughing exercises because it helps for the lung to be able to expand. Then next is initiate chest physical therapy as prescribed. So CPT is performed in order to facilitate the drainage of the abscess. Another one is we need to ensure proper nutritional intake. It is necessary because, again, our patient is in a catabolic state. Next is we will teach the significant other or the caregiver about postural drainage and percussion techniques, and also teach the significant other or the caregiver on how to change the dressing to prevent skin excoriation and offensive odor. So, naulit lang yung initiate chest physical therapy. And lastly, we offer emotional support as it can help the patient to be relieved of anxiety and stress because the abscess may take a long time to be resolved. For the prognosis, with timely antibiotic treatment, the prognosis of a lung abscess often depends on the underlying cause, and many lung abscesses resolve without any long-term problems. Prompt recognition and treatment of a lung abscess are important for reducing the risk of complications. As with many conditions, prevention is key. Good dental hygiene, prompt medical attention for suspected pneumonia, careful management of blood sugars if you have diabetes, and airway management can help reduce your risk. So in most cases, primary lung abscesses are successfully treated by empiric antibiotic therapy followed by targeted therapy depending on the gram stain and culture results with a cure rate of around 90%. Secondary abscesses need treatment of underlying causes to improve the outcome. So another fun fact, lung abscess was a devastating disease in the pre-antibiotic era. When 1/3 of the patients died, another 1/3 recovered, and the remainder developed debilitating illnesses such as recurrent abscesses, chronic emphysema, or other consequences. And after the penicillins and tetracyclines became available, the outcomes for these diseases have significantly improved.
So, thank you so much for listening to my report, even though it's a shame na we had to do it this way. Pero hindi natin makokontrol ang panahon. So, we do what we can. And if you have any more questions or other things that you want to learn about lung abscess, there are other sources available also in YouTube or other reading materials. So I hope you learned something today, and I'll see you around. Bye!